Welcome to a new episode of Medicine in 3 minutes. As usual, we go straight to the point. The subject is briefly made clear and often illustrated. Let's start. Today's topic is about Marfan syndrome. Marfan syndrome is a connective tissue disorder, and this is the classification of the connective tissue disorder. There is two types. There are autoimmune disease and inherited disorder. Autoimmune like rheumatoid arthritis, systemic lupus erythematosus, polymyositis and dermatomyositis, scleroderma, and Sjogren's syndrome. For inheritance disorder, there is osteogenesis imperfecta, Ehlers Danlos syndrome, Marfan syndrome, Alport syndrome, and epidermolysis bullosa. Today, we will focus about Marfan syndrome. What causes Marfan syndrome? Marfan syndrome is caused by mutation in the FBN1 gene in chromosome 15, which encodes fibrillin 1, a glycoprotein component of the extracellular matrix. From the epidemiology point of view, there are about 1 in 5,000 to 10,000 individuals have Marfan. It occurs equally in male and female, and rates are similar between races and different regions of the world. We will see symptoms one after the other. Heart mitral valve prolapse, aortic dissection, skeletal muscles, arm span, osteoarthritis, scoliosis, ectopia, and slip lump exam. We will deal with the differential between osteogenic imperfecta and Ehlers syndrome and Marfan syndrome, and we will talk about the treatment. From the histological point of view, we have to talk about 3 diseases in the same time: osteogenesis imperfecta, Alport, and Marfan. Osteogenesis imperfecta is type 1 collagen that we find in bone and scar. The type 2 collagen is in the cartilage, and the type 3 collagen is in skin. Alport, however, it's about a basement membrane in the kidney. For Marfan, is fibrillin elastic in the ligament and the lung. I repeat, osteogenesis imperfecta is the bone. It's a collagen type 1. Collagen type 2 is in the cartilage, and collagen type 3 is in the skin. For Alport, it's about basement membrane in the kidney, and the collagen is type 4. For Marfan, is fibrillin elastin in the lung. One characteristic of Marfan syndrome, arm span or wingspan, the length from the end of individual arm to another, it's parallel to the ground at 90 degrees. Among characteristics of Marfan syndrome is mitral valve prolapse. This is the left ventricle, this is the left atrium, and this is the prolapse. And the dip of the prolapse is here. And no quieting distance between valves. Aortic dissection is among characteristics of Marfan syndrome. The picture here is to show the hypermobile joint. This one is also to show hypermobile joint. Scoliosis is among symptoms of Marfan syndrome. An important characteristic of Marfan syndrome is ectopia lens, which is a displacement of or malposition of the acrystalline lens from its normal location. A partial dislocation of lens is termed lens subluxation or subluxed lens, but a complete dislocation of a lens is termed luxation or luxated lens. Bleu sclera is a symptom that is common for Marfan syndrome, osteogenic imperfecta, and Ehlers Danlos. From the differential between Ehlers Danlos, Marfan syndrome, and osteogenic imperfecta, there is some intersection here, which is Marfanoid syndrome. And between Ehlers Danlos and osteogenia is osteopenia. Here are the essential points of the Marfan syndrome. It's a mutation in fibrillin, glycoprotein of vessel and ligament. From clinic symptomatology, there is heart mitral valve prolapse, aortic dissection, anomaly of skeletal muscle like scoliosis. The individual is taller than the average. There is arm span extensible, a hypermobile joint, osteoarthritis, limited range of motion, scoliosis, ectopia lentis, dislocated land, and slip lump exam. As a differential, it's between osteogenic imperfecta and the Ehlers Danlos. From the point of view of treatment, to treat Marfan syndrome, we focus only on cardiac complication. We give beta blockers to lower cardiac contractility and to prevent endocarditis prophylaxis by antibiotic. Remember arm span, wing span, the length from the end individual arms to the other parallel to the ground at 90 degrees. Don't forget about mitral valve prolapse between left ventricle and left atrium. We appreciate the depth of the prolapses and no coating distance. Aortic dissection is among characteristic of Marfan syndrome. Regarding to the A, there is ectopia lens, which is a déplacement of malposition of the acrystalline lens from its normal location. If the dislocation is partial, we call it lens subluxation. If it's complete, we call it lens luxation. Bleu sclera is a characteristic common for Marfan syndrome, osteogenic imperfecta, and Ehlers Danlos. Marfanoid syndrome allows the difference between Ehlers Danlos and Marfan, and osteopenia can differentiate between Ehlers Danlos and osteogenesis imperfecta. Don't forget beta blocker to diminish the contractility of the cardiac muscle and the prophylaxis of endocarditis by antibiotic because there is a prolapse. Thank you for watching this episode of Medicine in 3 minutes. Would you like to click the like button and subscribe? Your comments are very welcome. Thank you.